Girl Scouts, we're here at the Girl Scout Dreamland with Angela Bai.
Angela is the CEO of College Invest.
I've participated in lots of the Inspiring Futures programs, but my favorite has been the one with people from SeaWorld because I would like to work with animals someday. Lily, what's been your favorite?
My favorite Inspiring Futures video was the one about going to the light pictures for the circus because I've always wanted to know how lights work or what improves them. Angela, you are our age. What future dream inspired you?
That's a great question, Lily. When I was a young girl, I dreamed of working at the Denver Zoo. And when I turned 30, that dream came true. But what's most important at your age is to see that absolutely anything is possible. And so through Inspiring Futures, presented by College Invest, you get to meet some amazing women. Women who are working with animals, racing cars, catching criminals, helping those in need, and so, so much more. And so girls,
let's be inspired.
Hi, Girl Scouts. It's nice to see you. Welcome to Inspiring Futures. So I'm Katie Herstein, and I am the Program and Events Manager at Girl Scouts of Colorado. So in my job, I get to be the lucky one to host Inspiring Futures, and where we're introducing our Girl Scouts to a whole bunch of accomplished women in a variety of professions, so you can begin to inspire about what your future might look like. So we have the perfect partner, which you just heard from, College Invest. So College Invest, and you saw Angela Bayer, their CEO, they're Colorado's college savings program. So it makes it easy to save for education after high school. So they basically exist for one reason, and that's helping you to pay for your inspired future. So it's College Invest is kind of like a piggy bank that your caregivers, grandparents, parents, anybody can, birthday money can go into a College Invest savings program where it will earn money. And then once you're ready for college, you can take that money out, and it's taken out tax-free. So it can be used for trade school, apprenticeship programs, or colleges anywhere across the country. So they're a terrific program partner that we have here at Girl Scouts of Colorado, and we're so happy that they're bringing this Inspiring Future series to us. So next up, we are going to housekeeping things. So we are recording this session so that we can have it up on our YouTube channel for girls that weren't able to attend tonight. They can still watch the recording and listen and be inspired. We'd love to see you if you want to turn on your videos now, or you're also more than welcome to use the chat function. That's absolutely fine too. So next up is our Girl Scout promise and our Girl Scout law. And if anybody wants to unmute and do it along with me, you're more than welcome to. Are you ready? On my honor, I will try to serve God and my country, to help people at all times, and to live by the Girl Scout law. And the Girl Scout law. I will do my best to be honest and fair, friendly and helpful, considerate and caring, courageous and strong, responsible for what I say and do, and to respect myself and others, respect authority, use resources wisely, make the world a better place, and be a sister to every Girl Scout. So, and with that, I want to welcome our guests that we have here from Rocky Vista University. And these wonderful young adults are in medical school right now. So we have Marissa, Robert, Tiana, Rebecca, and Jordan. So I'm going to stop sharing my screen, and they can take it from here. So Girl Scouts, don't be bashful. Put some questions in the chat whenever something inspires you. Make sure you connect with us, okay?
Okay, I'll share my screen. Can you all see that?
Yes, we can.
Okay. Okay, so we are all second year medical students at Rocky Vista University in Parker, Colorado. We're going to kind of introduce ourselves as we go. So I will just start our presentation. And I do just want to say too, Lexi is also on here. She's also a second year student. I just didn't want her to get overlooked. But yeah, so we will start. So the road to becoming a doctor, how do you become a doctor? These are the 4 main steps in becoming a doctor. So where most of you probably are at this moment is this first step where you're finishing high school in the coming years. And then after high school, you would go into college and complete a bachelor's degree. After college, you'd go to medical school, and that's where all of us are at this stage. All of that is kind of each 4 years. And then after medical school, depending on what kind of doctor you want to be, you go into your residency, and that can range anywhere from 3 years to like 7 years, depending on what you want to be, what kind of doctor you want to be. So there's kind of 2 routes you could take going into medicine. The traditional route is more of you just do all of those 4 steps straight through, and that takes about 12 years total. And then there's the non-traditional route, which is what most of us actually took, and that's when you kind of put breaks in there, you take gap years, whether that's for working or traveling or just different experiences. And that then takes longer, but I'm going to have some of our panelists introduce themselves and talk about their different paths to medicine at this point. So anybody can go ahead. Oh, shoot.
I can start. Hi, everybody. My name is Tiana, and I took the non-traditional route. I knew after college that I wanted to take some time. I didn't quite know it was going to end up being as much time as it was, but that's okay. Out of college, I worked as an infectious disease lab technologist, which just is a fancy way of saying that I tested blood for organ donation. That was pretty cool. And then after that, I became a medical assistant. So I worked for a doctor and basically did everything that he needed. And then I also got my master's degree. So I did even more education on top of everything before getting into medical school. But here I am.
I can talk a little bit about my journey. My name is Marissa, and I finished college about 3 years ago, and I took a 2-year break in between. So I worked in the ER for a little bit, and that helped me kind of get a feeling for making the right decision that medical school is what I wanted to do. And so I did that for about 1.5 years, and then I traveled and took time off for about 6 months. And so I could kind of get a break before starting school. So semi-traditional route, and that I studied science, biology specifically in college, and then took 2 years off before starting school.
Hi, everyone. My name is Jordan. I also had a non-traditional route like Tiana. So I spent 5 years doing my undergraduate for college. I didn't know if I wanted to be a doctor at that time. So I spent a little bit of extra time figuring that out. And then after I graduated from college, I spent time working as a scribe. So a scribe is someone who takes notes for a doctor, and they work closely with a doctor to help order medications or type notes that might need to be important for the visit. And then I did my master's, and then I went to medical school from there.
I can go next. I'm Lexi. I took only 1 year off after college. I kind of decided I wanted to go to medical school kind of late. So I was kind of rushed, but I just took 1 year off, and I worked as a medical assistant for a dermatologist during that year.
Hi, everybody. I'm Bobby, and I think I'm the most non-traditional if there was a competition here. I took 12 years off before even going back to school. And I left high school and I actually got a GED all the way back in 2004. So that just shows you a little bit of how old I am. And in that time, I worked in the healthcare industry for 10 years. I worked some other odd jobs off and on before finding out that medicine was my passion. I went to CSU in Fort Collins and got a master's degree. And then before coming to medical school, I was actually the chief forensic autopsy technician in Austin, Texas. So if you ever seen a crime drama show or anything, I was the guy doing the autopsies.
All right, and then I'll just go to, my name is Becca, and I also had a non-traditional route into medical school. I took about 3 years off between my undergrad and medical school, and I worked as a medical assistant during that time at a little rural clinic in my hometown. And then I traveled a little bit as well and just kind of tried to enjoy life before getting into medical school. Okay. Oh. Okay, so these are kind of some things to consider at each step on your path to medical school. So in high school, where some of you may be at, you could start thinking about taking some AP level coursework, maybe some dual credit, science classes, things like that, because then in college, those classes can act towards college credit, and so you wouldn't have to retake those classes in college. Me personally, I took some summer classes in college as well to kind of lighten up the course load through my semesters. In medical school, I am not aware of any 3-year medical school programs, but I know that there are some programs that do a combined bachelor and medical program. So you would do your bachelor's degree in 3 years, I believe, and then you would go from there directly into medical school, and those programs favor their bachelor degree graduates. So you could look into a few of those throughout the country. Then residency, you kind of just do your residency. And then if you want to specialize further after your residency, then you could go into something called a fellowship. And that is normally 1 to 3 years, depending. But that's if you really want to get really specialized in a field. So when you're actually applying to medical school, this normally happens either your last year of college or after you've graduated, like many of us probably after we graduated from college. So the first step is that you take your standardized test called the MCAT. And this is kind of a culmination of everything that you've learned in college, from like physics to organic chemistry to biology. It's a very long test. Then after you get your scores back from that, then you start your primary application. So that is more of your background, the whole question of why you want to be a doctor. Then you submit those and you get your secondary applications, and those are more essay, kind of short answer questions about your strengths and weaknesses, different life experiences you've maybe had. And then if the school really likes you, they'll offer an interview. And previously, these were mostly in person. You'd have to travel to the schools, but when I was applying, that was after the COVID era. And so all of my interviews were over Zoom, and I think a lot of schools have kind of switched to that because it's cheaper, and cheaper for students, and they can interview more people that way. And then after the interviews come your acceptances, and then hopefully you're accepted into medical school. For me, myself, I had to apply to medical school twice. So I had to do this whole process twice, and then I finally got in. But it wasn't a failure, it was just a little bit of a setback. So now we are all in medical school, and what does our daily life look like? I will have our panelists kind of talk about their daily life now as well.
I guess I can start again. The day in the life of a med student. So I wake up in the morning, get ready, eat breakfast, do all of that normal stuff. And then I usually start studying around 8 a.m. or going to class. We do have lectures throughout the day. So I will attend those if they are over Zoom. I am an at-home studier. So if they're on Zoom, I will do them at home. If they are live lectures where you're supposed to be at the school, I'll watch those later. It's just kind of what I prefer to do. But everyone is different, whatever works for them. I will study all day, basically until 5 p.m. And then I usually work out, eat dinner. I'll do a little bit of studying before bed again, and then wake up and do it all over.
I can talk about my general schedule. So I like waking up early and starting my day early. So I usually start and work out. And one thing I really like about medical school is the level of flexibility that we get. Since all of our lectures are recorded and there's only a couple of things that are required for us to go to in person, I usually like watching lectures later and studying on my own. And so that gives me time in the mornings to do things with our clubs or do some volunteering if I need to. And so my day, I kind of just like spread my studying throughout the day whenever I have time. But that's one thing that I really like about medical school as opposed to college and high school, is that you're not required to be in person sitting down for 8 hours. And so you kind of get the flexibility to make your own schedule, but it also means that you have to be pretty good with time management.
So my day looks pretty similar to Tiana's. I don't wake up too early. I wake up at about 7 a.m. I take my dog for a walk. I'm sorry, I have some people outside of my window, so sorry about that. I take my dog for a walk and then I get myself ready. I start watching lectures and get breakfast going. And then I usually watch lectures and do what I need to do. I'm so sorry, whether it be volunteering, going into school until about 5 o'clock. And then I spend time with my fiance and we work out together. And then I'll do some more studying before bed. Take my dog for another walk into the dog park and then go to bed early.
I can go. I don't follow a super strict schedule. Like each day looks pretty different for me. I try to start studying by 8 in the morning most days. And I'll study, throughout the day. I take quite a few breaks throughout the day. Also take my dog for walks. And then at night, I'll do some more studying, but just casual, not as focused, honestly. So
I stick to a pretty tight schedule every day. So one of my favorite hobbies to do is I like to cook. So I try to schedule my day around when I can actually get time to cook. So first thing I do in the morning is I take my dogs out for a walk. I have 2 very old dogs who need to go out first thing in the morning. So I take them out and then I come back inside and I cook breakfast for my wife and I, and then she'll start working and then I'll get dressed for school. Unlike everyone else, I like to be on campus every day. So I'm there Monday through Friday, 8 a.m. until 4 p.m. And then right at 4 o'clock, I leave every day and I come home because that's when my wife gets off work. And then I'll take the dogs out with her. We'll go for a walk and then I'll cook dinner. And it's my hobby. It's my fun thing I like to do. So I go over the top just about every day for cooking. And then I'll start studying a little bit later that night. But I always try to make sure that I set time aside throughout the day to take breaks, go for walks, get my cooking in that I like to do, all the fun stuff.
Yeah, and then my schedule, I am a morning person. So I generally wake up around 6. I take my dog for a walk in the morning when it's quiet and nobody's out. And then I generally start studying around like 7 in the morning. But then kind of the same with everyone else. I try to schedule breaks throughout my day. I generally schedule like an hour and a half to go to the gym. My boyfriend and I take our dog out in the evening together too. So, and then I normally stop studying school things around like 7 p.m. too, and then just have my evenings. But yeah. Okay, so like I said, we all go to Rocky Vista University in Parker, Colorado. This is our school. So we have, there's a couple different programs at our school. So we are all in the Doctor of Osteopathic Medicine program. That's the DO program. And then there's a physician assistant program as well, and a Master of Science program. And most of the students in the Master of Science program go into the DO program after their 1 year in their master's. So we can do a little school tour. All right, can you all see that? Okay. So this is the outside of our school. We can walk inside, and this is our front security desk. This is George up in the upper left. He always gives us pep talks before our exams in the mornings. He's our security officer. And so we can go into our simulation lab. And this is where we are able to practice all of our kind of doctoring skills on mannequins before we do them on real patients. So one mannequin we have, she actually gives birth. She simulates birth. So here this student is practicing delivering a baby with this mannequin. And then these are our standardized patient exam rooms. So a couple times a semester, we come in here and we practice all of our kind of physical exam skills, history taking, things like that on real actor patients. So they're real people. They are hired to kind of pretend that they have something, a medical problem. And we come in as the student doctors and we take their history of the problem. We do our physical exam, whatever exams we think they need. And then we try to come up with what could be wrong with them and what treatment they need. And then we'll come back out to the front. We'll go, this is our front lobby. So this is just kind of like a waiting area. If we have like school tours or something like that, this is where people meet. Then we'll go outside again. This is our east lawn. So this is where like a lot of clubs will have some activities throughout the year. People can come out here and just hang out if it's a nice day. Then we'll go back inside, and this is our first floor hallway. So all of these doors along the sides here, those are classrooms for us. So we can come into this one, and this is our big auditorium lecture area. And so when we are in person for in-person lectures, this is where we all come. We come here for our exams, but kind of like everyone was saying, we are a hybrid school. So we do some in-person lectures, some video, like pre-recorded lectures, and then some Zoom lectures. And most of the lectures that are in person are recorded, so people can watch them at a later time too. So it gives us a lot of flexibility, which is really nice. And then we can come back out. We'll go up to the second floor. This is our second floor hall. So we actually just had our club fair today. So it looked very similar to this. We had a bunch of tables out and we were showing everybody all the different clubs that the campus has to offer. If we come in here, this is our student lounge area. So we have some ping pong tables, some foosball. This is where people come to just hang out, kind of decompress or something after a test. Then we can go into our workout room. It's not super big, but it has the essentials. And if we're on campus for long days and just need a place to move our bodies, this is a good place for it. And then we have a little tranquility room as well. I have never been in here, but I've heard that people sometimes take naps in here. Again, they can come in here after tests to decompress. And then this is our lunchroom. So we don't have a big cafeteria like maybe some of your high schools do, but we have a lot of microwaves with some big refrigerators that people can put whatever food they want in from home to save for later, whatever, and then just a bunch of little tables that people can use for lunch or snacking or anything. And then we'll come back out. We will go up to our 3rd floor. And then on our 3rd floor is where all of our labs are. So we'll come in here, and this is our anatomy lab. So this is where we do our cadaver dissections during our 1st year of school. So in each of these silver tanks is a human body that has been donated to us for our medical education, very graciously. And so with every block that we go through, so every different system course that we learn, there's a corresponding anatomy lab that we dissect. So when we learned about the heart, we dissected the heart. And when we learned about the brain, we dissected the brain and the skull. So it's really hands-on experience, which is really something special that RVU has compared to some other medical schools. So we can come back out and then come into our clinical skills lab. And so this is where we learn all of our doctoring skills that we can then practice in our simulation lab later. So this is where we learn how to do our physical exams. We've learned like suturing, things like that. In this picture, these students are learning how to do injections. And so they're drawing the medication out of the little glass bottle, and then they're going to inject it into this hot dog that simulates human skin. And then here too, we also learn our osteopathic manipulative medicine skills, and that is something that is unique to doctors of osteopathic medicine, and I will go into that in a little bit. Then we can come back out and we'll go into our library. So this is where a lot of students end up studying throughout the day. All these rooms along the side here, they are private study rooms that can be reserved. And then we also have some textbooks that can be checked out if needed. Luckily, a lot of our textbooks are online now, so we can just get them from the library website. And then we also have bone boxes, so we are able to study the bones and how they actually look in a human body. And then there's also some lecture rooms in the library as well for club meetings or just like smaller presentations, things like that. So that is the end of our school tour. Let me get back to my, maybe, oh boy. Hang on, let me find my presentation. Okay, can you guys see that? Okay. So, like I said, we go to a doctor of osteopathic medicine school. And does anybody know what the difference between a DO and an MD is? You can unmute, you can type in the chat, or you just don't have to. So. Okay, well, it is a trick question. there is the difference between an MD and DO is very minimal. We are actually very similar. We both complete the same amount of medical school. We both go to the same residencies. We're able to diagnose and treat patients, perform the same procedures, prescribe the same medications. The only difference is that DOs have this extra skill called osteopathic manipulative medicine. And so that is when we're able to diagnose dysfunctions and restrictions in our patients' bodies using techniques that we learn with our hands. And then we're able to treat those dysfunctions through different methods and procedures that we learn in our osteopathic manipulative medicine class. But we can all practice the same in the same specialties and everything. And so here is it's not a full list, it's a short list of some specialties that doctors can go into. And then the number of years it takes in residency. So like I'm interested in dermatology potentially, and so that I would have to go to residency for 4 years. Same with family medicine, that's about like 3 to 4 years of residency. And then when we get into more of the surgical specialties like plastic surgery and neurological surgery, those are more like 7 years of residency. But then when we look at a pay scale, those surgical specialties get paid quite a bit. And so they go to school longer, but they have a high pay rate out of school. And then you see family medicine kind of down at the bottom, and though they're paid less, I mean, that's still a lot of money, but they're paid a little bit less on the doctor range. And this is also dependent on the state that you live in and the type of practice that you work in. And so lastly, we just have some current advice for you guys at this stage in your education. It is never too early to start working towards a career in medicine. And this kind of ties into the second bullet point as well. If you're thinking that you're interested in medicine, reach out to physicians, physician assistants, nurses, physical therapists, anybody, and shadow and figure out if it's something you really like doing. And then you can go from there and figure out what role you want to play in the medical field. No one way is the right way to get into medicine. So clearly we've all had very different paths to medicine, and we're all going to be doctors at the end of the day together. And then surround yourself with a good support system. This is super important because sometimes, you know, like I said, I had to apply to medical school twice. It can be very stressful when you're in medical school. And so having a good support system that you can lean on and confide in really goes a long way in how you're able to handle the stress of it. And then enjoy the journey. It's not just about the destination. And that just means that medical school is a long road. Becoming a doctor is a long road, all the different steps to it. And you should try to enjoy the whole journey of it because otherwise it's going to be a long, long way to that destination. All right. Any other questions that haven't been answered in the chat?
It looks like Serena asked how many medical students per year in each class?
So that kind of depends on the school. At our school, we have about 200 per class, and that went up in the last couple of years. So I think before our class, it was around like 150 maybe, and then it went up to 200.
All right.
There's also a question from Mackenzie. It says, how did anyone get the decision to go into the medical field, and when did that decision come to mind? For me, I don't really have a good answer for this question. I have wanted to be a doctor my entire life, and that's really all I got. So yeah.
I think it's different for everybody. I didn't know that I wanted to be a doctor until I started back going for my undergrad. And I read a book by a forensic anthropologist called The Bone Woman's Diaries. And it was a story of her life. And I was like, this sounds cool. And then I looked into how to do it and I was like, I want to be like this lady. And that pushed me towards going into medicine.
I think also trying different things. So I knew that I loved medicine, but I wasn't sure if I liked medicine for people or animals. So I worked at a sea lion rehabilitation facility in Santa Barbara for 3 years. And I learned through that experience that I needed someone to talk to and be able to talk to me. And so that helped me find out. So I think having experiences like shadowing a doctor helps you see if it's something that you do enjoy.
Yeah, I agree. And I see, I'm kind of going to tie in Adelina's question about what I wanted to do when I was little. So when I was little, it was not medicine. I really wanted to be a writer, like a creative writer. And I loved animals. So I thought, oh, maybe being a veterinarian, kind of like Jordan. But I realized I love animals too much to see them in pain. And while I love people, it's like something I can kind of explain and work through a little bit. So I was interested in human biology in high school. And then I agree with Jordan, like shadowing is the best way, because I'm sure you guys have heard about nurses and PAs, and they're all in healthcare, but to decide what you really want to do and what best fits your goals and your personality, I think you really need to shadow and get experience. And so however you're able to do that, whether you have family, friends, or anyone, just being able to see what you're comfortable with, like, are you okay with seeing blood and seeing people in pain? Those are just things that are really important to learn now, because you don't want to put all this effort into going to medical school if that's not the right thing for you.
So Allison has a comment about basically financing medical school, but College Invest is a good way to do it.
Great way to
Saving
do
your
it.
money early.
Yeah. I think, at least for myself, I have taken out loans to pay for medical school, which I will have to pay back at some point. And I know there's different scholarships that the school offers. They're not like full ride scholarships, but they can make a little bit of a dent. And then there's like the military, they do full ride scholarships, but then you have to dedicate a certain amount of years back to them. However many years they pay, that's how many you will give them back. Yeah, anybody else have any insight?
I had a lot of money saved from when I was little. I every year got money for my birthday and I put it into an account and saved a lot, actually. That paid for undergrad for me. I also went to a fairly cheap school for undergrad, so that helped. And then just like Becca, for med school and my master's degree, I took out loans and I will pay all of those back. For Caitlin, your question about the most difficult thing, I think the most difficult thing is honestly studying all day, every day. It can be exhausting. You have to remind yourself what you're here for, what you want to be, and that helps. Yeah.
It's a little bit like people say, like drinking out of a fire hose early on, and you're just consuming so much information. But it's also pretty cool that you are here and you're able to learn all that. So I think you adapt and you get better at managing the amount of studying it takes, but it definitely is a lot early on, especially.
I have a question about the shadowing part that you were talking about. So how would these girls, like when did you know how did you know who to find? And that might say, yes, you can come shadow me. Do you have to be like a certain point in your education, or when does that happen?
You can actually shadow at any age, well, high school on, I believe. but it's kind of difficult. I had a really hard time with it. I don't have any doctors in my family. I didn't know any doctors that I could shadow. So I just applied to work in the field. And then once I started working in the field, I was able to make those connections with doctors to shadow them. A lot of people will find a connection through a family friend or, something like that. And then they'll ask the provider to shadow them so that they can get those hours.
Great.
Yeah, for me, I honestly just asked my family medicine doctor that I would go see for like my sports physical every year. I just made it known that I was interested in the medical field and just asked if they would let me shadow them for even just a half day once a week, like during the summer or something. And luckily my family medicine doctor was open to that. So that's where I started with it. And then from there, then they had some connections that they then told about, and I was able to connect with them too.
Right. Great.
I personally, when I was my last 2 years of college and then the 2 years that I had before starting medical school, I was working in the ER. And so while I was working in the field, it entirely opened things up because once doctors know you, they can kind of trust that you're like mature and you know how to act in a medical environment, which is really important. I think it's the only reason that sometimes they're worried about letting people in, because if you have someone shadow in the ER, it can be like a very intense environment. And if you've never seen that, they just don't know how you're going to react. But if you make one connection, you can make 10 more from there and it just grows. And so any sort of small connection you can make, even if it's, you can talk to your professors and say, hey, I'm really interested in medicine. Like, do you know anybody in the medical field? And even if it's a friend who's a nurse, or your parents' friends that are nurses, they have connections. And so if somebody knows you, they will trust you and your network will grow a lot from there.
Right. That's great. Great information. Oh, so that's an interesting. Did you see in the chat, the band class, the teacher says that people with musical degrees get into med school easier. Did any of you have music in your backgrounds?
I did not. Not music. Not for me.
I do know someone who majored in art, but on top of their art degree, they also had to take all of the required classes. So normally before you apply, they make sure that you've taken all of the basic college classes, such as organic chemistry, biology, maybe even physiology or microbiology. So it's great to be well-rounded and to do what you love. But you usually on top of that also have to take all the required classes before you enter medical school.
Right.
Yeah, in college, I majored in physiology, but then like to get my little creative kick, I took like a dance class or something like that. But I've heard the same thing, that if you actually end up majoring in like a creative arts thing, if that's something you're super passionate about, that's amazing. But on top of that, you just have to be aware that you're going to have to do all the science classes as well. So it kind of adds a little bit extra to your workload.
Right.
I wasn't in music classes for my undergrad. My undergrad's in anthropology, but for anthropology, it doesn't require you to take any of those prerequisites for medical school. So what that meant was that all of my elective classes for college, I had to take all of the prerequisites for medical school. So I didn't get to take fun classes. I had to take organic chemistry as my fun class.
I think
That'd
mainly
be very
what
fun if that's your thing, right?
yeah, I think mainly what a lot of schools like to see, like medical schools when they're looking at applicants, is that you're well-rounded and that you are not 100% only interested in medicine. Like you also have hobbies and interests, because if you get into school and that's all you have, it's really stressful. And so you need something to take a break, whether it's like cooking or reading or sports. And then that also just makes you a more interesting person. If you go out and all you can talk about is medicine and science, it's not great. And so I think that's kind of maybe what your teacher was getting at, is that like having another interest or just being a little bit like different and well-rounded is really helpful in the application process.
Yeah, I can see that actually, because I think of any doctor that I've gone to, as a patient, you feel more relaxed if that person feels more human and that they, also ski or, do things that you could talk about besides what is ailing you, sort of thing. So I can see why that would be so important, because you don't want to have someone cold and disconnected that's treating you. So could you be a doctor and a biology teacher as well? Oh, interesting. So some of the professors are doctors and then they come and teach at school too. So they're maybe further on in their lives, like they got a secure practice that they're working in, and then they've got some time.
Yeah, a lot of it is for lab, like when we're learning those skills that we need to know to be a doctor, like suturing, tying or suturing a wound. I can't think of the other word right now. A lot of them are doctors, and then they come in and they teach us how to do that, and they have their own practices, or they're retired. They used to practice and now they're retired and they're coming and teaching us. So.
Right. Neat. And then I thought of another question during your presentation about studying for the MCAT. So did you take months and months and months and months to study? All I know is the ACT and the SAT right now, with my daughter going through just the undergrad process. So I have no idea what the MCAT and for law school and all these after undergrad exams that you have to take.
Yes. So I took the MCAT after I graduated from college. I just couldn't wrap my head around trying to study for that and finals in college and everything. So I took 3 months after my college graduation to study for the MCAT. They recommend like actually putting a limit on how much you study. Like, don't study for like 6 months leading up to it, because that's almost too much. I'm sure maybe that works for some people, but I think that was good advice for me, because I probably would have just lost my mind a little bit studying for 6 months. For the MCAT at least. I mean, now I do it, but and then I also, to get started, I took like the Kaplan MCAT course, which I think was like 4 weeks. And they just kind of gave me a kickstart of like how I want to schedule my days studying for the MCAT, practice tests, like test taking strategies. And then after that course, then it was mostly just like self-studying based on practice questions and things like that.
Great.
I personally had set a schedule for myself to study for 3 months while I was in school, but taking a lighter load my last semester of senior year in college. And then I started studying in January to take it in March. And then that was right when COVID happened. And so I got rescheduled to May. But basically my plan was to study like a couple hours every 5 days of the weekday, and then do a practice exam on the weekends, and then review that and take a day off. So it is definitely something that you need to study for. But it also helps if you're able to like really retain the knowledge that you take in your core classes like physics and chemistry and biology and psychology, because that's what the topics are on the MCAT. But it is a really hard exam and it's not fun to take at all. So
I took an MCAT crash course because I actually took it 4 times and wasn't doing well. And I was like, I need extra help. So I did a crash course that was like 2 months, and it was all day, every day. You're in class learning, but it greatly improved my score. So if you are struggling, you can do something like that and end up, getting a lot better score.
I think it's very valuable to hear that, even if the first time it doesn't work for you, don't give up, and keep pursuing it. If you're so passionate about it, keep going, right? Yeah. I love that. Actually.
Absolutely.
It's not like,
I
sorry,
oh,
one
sorry.
time and you're done, you know?
Yeah, I took almost 10 years off. No, that's not right. 8 years off out of college. And so when I was studying for the MCAT, I hadn't had that education, you know, it was a long time ago. And so it was like relearning everything again. And I was struggling on my own. So the crash course helped me a lot.
I think one thing that's good to point out too, because the MCAT is, we were talking earlier about traditional ways to get into med school and non-traditional ways and how everybody has their own journey to get there. And there are a million different ways to get into medical school. Not really, but that's an exaggeration. For instance, RVU has a master's program. And if you get into our master's program, and let's say you really struggle, you're really, really smart, but you just struggle with those standardized tests, like the MCAT, it makes you really nervous, you don't feel prepared for it. If you can get into like our master's program, then you show up and you do the work and you pass your classes and you get good grades in the master's program, you're actually automatically accepted to RVU for the College of Osteopathic Medicine, and you don't have to take the MCAT. So there are multiple different ways to get into. So if you're like, I don't know if this is right for me, look into it. There are ways to get there.
Yeah, that's a good point, because people are definitely have challenges with standardized testing, and it's nice to hear that there's other ways. Okay, so Caitlin has said, do you know if there's an MCAT for veterinary school?
I actually just looked it up. It says that you can get in with your GRE. So that's like I didn't take it, so I'm not totally familiar, but I'm pretty sure it's like a general exam that you take after college that has more like history and everything on it as well. And so you can submit those scores, or it says you can also take the MCAT if you so choose, and you can submit those scores.
We had an Inspiring Futures with people at SeaWorld, and some of them worked in with dogs and cats and things, and decided that it would be interesting to work with seals and penguins. And so they, found their medical world with veterinary school, and, transitioned it over to different kinds of pets. The whole medical world is fascinating with, just moving among different things and your knowledge base and your specialties. And it's pretty fascinating. And do all of you have different final goals and where you want to end up in the medical world?
So, like I said, I'm interested in dermatology at the moment, but I am also kind of keeping an open mind as we go into our third year, because that's when we start our rotations in the hospitals and the clinics. And so that's when we'll be exposed to all the different specialties. So derm right now, I'm also keeping family medicine in mind. I really like rural medicine. I'm from a small town, so we will see what life has in store.
I'm really interested in working in the ER, I think is what I'm hoping to do. So I think it's about 4 years training after medical school, depending on the program you go to. And since I worked in it before, it's just what I really like.
I am hoping to do a dermatology and internal medicine combo residency. Internal medicine is like a family medicine doctor on steroids. And then dermatology is your skin. So that's what I'm interested in.
I am very undecided about what I want to do. So we will see next year what I like.
I am interested in neurology. I wanted to be a neurologist when I was younger, And then I got interested into dermatology. And then when we started dissecting again, and we saw the brain and the spinal cord, I fell back in love with neurology. So that's what it is for now. But I think, like Becca said, keeping an open mind and, allowing yourself to see the different lifestyles and everything really helps make your decision.
We have a question about, do you need to go to med school to be a dentist?
You go to dental school to be a dentist. I believe that you take an exam similar to the MCAT. I'm forgetting the name of it right now if someone else knows. But then you go to dental school, and that's also 4 years and a lot of work as well.
I have many dentists in my family. They do similar. So you do dissections like we do, but some of them focus just on the head and the neck. But you do, like Tiana said, you do take a similar exam and you do med school, but specifically for the teeth. So you learn everything there is to know about this area right here.
Well, this has been absolutely fantastic. Thank you so much. I know you are all very, very, very busy, and it's just fabulous that you've taken time out, and thank you for the presentation and to talk to Girl Scouts that are interested in, pursuing a medical future. I'm sure it's given them a bit of inspiration to, they can see themselves in their future going through these paths that you're going through, and figuring out their journey to get to where you are. So I appreciate it. Girls, do you want to unmute and thank them?
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Awesome. Thanks, girls. Okay, well, thanks everybody. And for Inspiring Futures for Girl Scouts, this is a patch program actually. So I will be emailing out to you all from the registration email that you entered when your caregiver registered you for this, a form that you fill out just with your information. And if you've been at an Inspiring Futures before, you've probably already received the main rocker, and the main patch. And this will be the STEM rocker that you will have for attending this today. So thanks so much, everybody. Good luck with your studies. I want to connect with you and hear what everything happens in a couple of years. It's gonna be so exciting. So thanks so much, and have a great night, everyone.
Thanks for having us.
Yeah, absolutely.
Bye.